I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. And in this segment, I'm going to be going over a continuation of eating disorders. In the previous video, I talked about some of the symptoms of OCD and some of the various types of OCDs. But Mental Health America uh, for Mental Health Awareness Month has put together some of these tests or brought to light some of these tests that are available. And these are self administered, not necessarily administered by professionals. And if you need guidance, then you can go to a mental health professional. This is not to diagnose anything that you may have. So here are the test questions, and oftentimes what I say always when you are taking these tests is looking at the time frame. So this is looking at different types of age groups, and how that is portrayed. So at the end, they'll focus on what your body mass index is, BMI, and kind of take a look at that and fluctuations in weight. So I'm going to read you some of the questions for the sake of time. I don't want to go through all of the questions because that would take another 30 minutes. So what are the first question is, how much more or less do you feel you worry about your weight and body shape than other people your age? And of course, there's 5 types of eating disorders. This only kind of generally looks at the overview of eating disorders. So here's another question, which is interesting. How afraid are you of gaining 3 pounds? And honestly, a lot of us that are conscious of their weight have the fear of going up or down. I know I do. But just one question does not imply having an eating disorder. A conglomeration of many questions makes people decide, makes, of course, healthcare professionals, or makes you decide. So awareness is much more important than anything else that you might have an eating disorder. So when was the last time you went on a diet? And the answers are quite a few. I was on a diet about 1 year ago. I was on a diet about 6 months ago, 3 months ago, 1 month ago, less than 1 month ago, and I'm on a diet now. And again, the diet in and of itself, or following a diet, is not eating disorder. It's when you have the whole gamut of symptoms, then you can say you've had eating disorders. So looking at how important is your weight to you. Again, in the past 3 months, how many times have you had a sense of loss of control? And you also ate what most people would regard as an unusually large amount of food. Um, and so you can kind of go up or down. And so obviously -1 is not a choice. But if it's 1 month, then it's skip logic. So in the last 3 months, made yourself throw up, used diuretics or laxatives, exercised excessively, fasted. But if you say, this is interesting, because if you say 1 month, then answer yes, then eat much more rapidly than normal. Eat until feeling uncomfortably full, eat large amounts, eat alone, feel disgusted, depressed, or very guilty after eating. Again, how distressed or upset have you felt about these episodes? And then it goes into made yourself throw up. And of course, this also is important to note. And then used laxatives, exercised excessively, fasted, and whatnot. So, again, looking at calorie counting, and then feeling struggle with the lack of interest. So what I recommend, and of course, looking at BMI, body mass index, based on height and weight. So what I recommend is going through this Mental Health America, go to through these symptoms, and then just taking a look as a gauge and understanding others maybe who are going through eating disorders, and of course removing that stigma surrounding eating disorders or other areas, the awareness allows you to understand others that may be suffering from these conditions. I hope this has made some sense. Thank you for listening.